multiple House members announced their retirement plans. The Senate looks to advance additional fiscal year 2026 appropriations bills. And Republicans debate how to address the expiration of Affordable Care Act enhanced premium tax credits. For the week of November 24th, 2025, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
Obamacare, which is the Unaffordable Care Act, it is totally unaffordable. You see the kind of money the insurance companies are making, hundreds of billions of dollars. We're going to give the money to the people to buy their own health care. And the kind of money that we give to the insurance companies is more.
Kicking off this week's episode with news from Capitol Hill, where lawmakers recessed for the Thanksgiving holiday without a plan to address the spike in health insurance premiums that are expected from the expiration of enhanced advanced premium tax credits at the end of the year. Democrats continue to push for a straightforward extension of the Affordable Care Act subsidies, and Senate Majority Leader John Thune has agreed to hold a vote on the extension no later than the second week of December. While House Speaker Mike Johnson has refused to commit to such a vote, there's some support in his chamber for a bipartisan solution. The Bipartisan Healthcare Optimization, Protection, and Extension, or HOPE Act, introduced by Representatives Don Bacon, a Republican from Nebraska, Tom Suozzi, a Democrat from New York, Josh Gottheimer, a Democrat from New Jersey, and Jeff Hurd, a Republican from Colorado, would extend the enhanced subsidies for 2 years, while phasing out access to the tax credits for those earning between $200,000 and $300,000 per year for a family of 4. Republicans are engaged in a debate amongst themselves on a path forward for a fix, along with potential reforms to address healthcare costs more broadly. During a Senate Finance Committee hearing last week, Senator Bill Cassidy, a Republican physician from Louisiana, unveiled his proposal to fund tax-advantaged health savings accounts, or HSAs, for bronze-level and catastrophic plan enrollees in the Affordable Care Act marketplace. Similarly, Republican Senator Rick Scott of Florida introduced legislation to establish Trump Health Freedom Accounts, which would provide the value of premium tax credits and cost-sharing reduction payments directly to enrollees to spend on healthcare expenses or insurance premiums. In a post on Truth Social last week, President Trump stated that he will not support legislation to extend expanded Affordable Care Act subsidies, noting that he will only support direct payments to individual Americans to help with their healthcare expenses. The president has not specifically endorsed any of the above proposals, but has indicated that he hopes to secure a solution by January 30th. The Government Accountability Office released a report last week on health savings accounts. The report, which was requested by House Ways and Means Committee Ranking Member Richard Neal, a Democrat from Massachusetts, found that health savings accounts use is concentrated among higher-income households, Asian and white individuals, people in excellent health, and those with employer coverage. Republicans on the House Ways and Means Committee have pitched a proposal that would allow Affordable Care Act enrollees to elect to receive financial assistance from insurers via their health savings accounts. During a closed-door meeting on Tuesday, House Republican leadership expressed a preference for broader health care reform rather than a tax credit extension. House Majority Leader Steve Scalise has stated that he's in conversations with the 3 committees with health policy jurisdiction on a legislative solution for lowering healthcare costs, and that he expects to bring forward bills to promote health savings accounts and association health plans. Last week, both chambers of Congress released their calendars for 2026. Both the Senate and the House of Representatives will recess for nearly all of the months of August and October ahead of the midterm elections. The 2 chambers will also recess alternating weeks leading up to January 30th, the next government funding deadline. The Senate is set to be out the week of January 19th, while the House is set to be out the week of January 26th. The yearly congressional calendars, however, are always subject to change.
And there's a lot more we could accomplish too, from improving our healthcare system to passing a farm bill. But not if the vast majority of the Democrat Party continues to put partisan politics above the well-being of the American people.
The Senate has hotlined an appropriations minibus package, including the following fiscal year 2026 appropriations bills: Labor, Health and Human Services, Education and related agencies, Defense, Commerce, Justice, Science and related agencies, Transportation, Housing, and Urban Development and related agencies. Leadership hopes to advance the funding package after the Thanksgiving holiday. The Senate hotline process will identify which senators have objections to the package. The latest continuing resolution extends government funding for the agencies through January 30th. Enacting fiscal year 2026 spending bills would provide funding through September 30th. House Appropriations Committee Chair Tom Cole, a Republican from Oklahoma, has indicated that House Republicans are unlikely to consider any more fiscal year 2026 appropriations measures until the Senate completes work on the minibus that it's seeking to advance. The Senate Finance Committee and the Senate Homeland Security and Governmental Affairs Committee have advanced the nomination of Thomas Bell to serve as Inspector General of the U.S. Department of Health and Human Services. Bell most recently worked as General Counsel for Republicans in the House of Representatives. Both Senate panels approved his nomination along party lines. Senate Democrats have characterized the president's removal of the prior HHS Inspector General as unlawful, raising foundational concerns with Bell's nomination process. Bell now awaits a Senate floor vote on final confirmation. More news today, where Democratic leadership of the House Education and Workforce Committee have written to the Trump administration regarding wrongful and improper claim denials by group health plans and insurance companies. The letter reads, quote, "Improper claim denials impose substantial health and financial hardships on individuals, leading to delays in necessary treatments, worsened health outcomes, and high out-of-pocket costs. In far too many tragic cases, denials lead to the unnecessary deaths of people who have earned benefits through their plan, but are nonetheless denied the care that could have saved their lives," unquote. The lawmakers urged the Employee Benefits Security Administration to implement transparency requirements to collect data on health claim denials by insurance companies and group health plans, commit to fully enforcing the law and ensuring that the agency is adequately staffed to fulfill its mission, and to take action to improve consumers' ability to appeal wrongfully denied health benefits.
In strong support of the previous question. For the first time in history, thanks to the Democrats' Inflation Reduction Act, the federal government is negotiating lower prescription drug costs for American seniors that will produce real savings next year. Now, if we pass this motion, then we'll be passing my Lowering Drug Costs for American Families Act, which expands these savings to everyone or every American who has private health insurance. So now as seniors, but it will extend to every American who has private health insurance. Now, we've already
Democratic committee leaders have introduced drug pricing legislation to build upon the Medicare drug price negotiation program. The Lower Drug Costs for American Families Act was introduced by Energy and Commerce Committee Ranking Member Frank Pallone, a Democrat from New Jersey who you heard at the top, Ways and Means Committee Ranking Member Richard Neal, a Democrat from Massachusetts, and Education and Workforce Committee Ranking Member Bobby Scott, a Democrat from Virginia. The bill would extend the drug price negotiation program to Americans with private coverage, apply inflationary rebates to individuals covered by private health plans, increase the annual number of prescription drugs selected for negotiation from 20 to 50, extend the annual $2,000 out-of-pocket cap on prescription drugs to people with private health insurance, limit out-of-pocket costs for insulin at $35 per month for people with private health insurance, close the orphan drug designation drug price negotiation loophole, and require the U.S. Department of Health and Human Services Secretary to consider the international price for the drug when negotiating prices.
You have lied to the American people. You have lied to parents about vaccines for 20 years. And I also want to be clear that I will lay all responsibility for every death from a vaccine-preventable illness at your feet.
That was the voice of Representative Kim Schrier, a Democratic physician from Washington, who led a letter to the Centers for Disease Control and Prevention last week regarding the recent acceptance of the Advisory Committee on Immunization Practices' September 2025 vaccine recommendations and the, quote, broader erosion of scientific integrity and trust, unquote, in the CDC's vaccine recommendation process. The lawmakers urged the reinstatement of all 17 former ACIP members, a recommitment to transparency and scientific rigor in the ACIP process, and clear, evidence-based communication to both healthcare providers and the public regarding the recent accepted ACIP recommendations. The letter was signed by 29 Democratic representatives. A bipartisan group of senators sent a letter to HHS Secretary Robert F. Kennedy Jr. regarding the regulatory and operational gaps impacting the implementation of the No Surprises Act. The lawmakers specifically expressed concern about the challenges faced by air ambulance providers and other emergency medical services. They urged the department to act swiftly to, quote, restore the No Surprises Act's promise of fair, timely, and transparent reimbursement for air ambulance services, along with its objective to protect patients from surprise medical bills, arguing that, quote, strengthening these protections is essential to safeguarding patient access and the sustainability of critical care providers nationwide, unquote. The letter was signed by Senators Jeff Merkley, a Democrat from Oregon, Susan Collins, a Republican from Maine, Ron Wyden, a Democrat from Oregon, Angus King, an independent from Maine who caucuses with Senate Democrats, Steve Daines, a Republican from Montana, and John Hickenlooper, a Democrat from Colorado. Senator Ruben Gallego, a Democrat from Arizona, has written to Eli Lilly and Novo Nordisk, requesting details on the company's agreements with the Trump administration to lower the prices of their weight loss drugs. The letter seeks clarification around how the newly announced deals fit within existing law. Senator Gallego also asks for information about the company's participation in Trump RX and the implementation of most favored nation pricing in the Medicaid program. More from Arizona today, where a bipartisan portion of the congressional delegation has sent a letter to the Centers for Medicare and Medicaid Services Director Mehmet Oz regarding the state's participation in the Rural Health Transformation Program. While the lawmakers thank Dr. Oz for ensuring that Arizona receives at least $200 million annually over 5 years, they assert that, quote, given the vast area, significant needs of the state, and rurality of so many Arizonans, Arizona should receive much more than that in order to adequately address the significant needs of its rural communities, unquote. The letter was signed by Democratic Senators Mark Kelly and Ruben Gallego of Arizona, and Representatives Juan Ciscomani, a Republican from Arizona, Yasamin Ansari, a Democrat from Arizona, and Greg Stanton, a Democrat from Arizona.
My district as well. I have too much self-respect and dignity. I love my family way too much, and I do not want my sweet district to have to endure a hurtful and hateful primary against me by the president that we all fought for, only to fight and win my election while Republicans will likely lose the midterms, and in turn be expected to defend the president against impeachment after he hatefully dumped tens of millions of dollars against me and tried to destroy me.
Representative Eric Swalwell, a Democrat from California, announced his bid for governor of California last week. Swalwell was first elected to Congress in 2012. He currently serves on the House Judiciary and Homeland Security Committees. Representative Marjorie Taylor Greene, a Republican from Georgia who you just heard, announced that she will resign from Congress on January 5th. Greene was elected to Congress in 2020 and currently serves on the Oversight and Accountability and Homeland Security Committees. New Jersey Governor Phil Murphy, a Democrat, has announced a special election to fill Governor-elect Mikey Sherrill's seat in the House of Representatives. The primary has been scheduled for February 5th, and the special general election will take place on April 16th. The House GOP holds a 219 to 213 majority following Sherrill's recent resignation. This advantage will be further narrowed upon Greene's resignation. Final news today, where the GAO has released a new report about improper payments and fraud in the Medicaid program. GAO's review of California, Georgia, New York, Pennsylvania, Tennessee, and Texas found approximately $1.6 billion in improper spending on behalf of approximately 500,000 individuals in fiscal year 2023. These individuals were simultaneously enrolled across multiple states in Medicaid or the Children's Health Insurance Program, or receiving an advanced premium tax credit across multiple states. The GAO recommends that the Centers for Medicare and Medicaid Services design or modify controls to help detect and prevent duplicate Social Security numbers from being used on multiple marketplace policies receiving advanced premium tax credit benefits, and require marketplaces and Medicaid and Children's Health Insurance Program agencies to submit all enrolled data to a data matching system for interstate matching on a frequently recurring basis, and to resolve all matches to verify eligibility or terminate coverage as appropriate.
Good morning and welcome everyone to the organizational meeting for the 119th Congress.
And I welcome everyone to the first Help Committee meeting of the 119th Congress.
Good morning and welcome everyone to the first meeting of the House Committee on Energy and Commerce of the 119th Congress.
The Finance Committee will continue its long tradition of addressing these matters in a manner that invites bipartisanship.
We end each week's episode with the Call to Order, where we lightning round congressional meetings and hearings in the near future that you need to know about. The first and only meeting on the calendar will occur on Thursday, December 11th at 10 a.m., when the Senate Health, Education, Labor, and Pensions, or HELP Committee holds a hearing titled Examining the Future of the U.S. Organ Procurement and Transplantation Network. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.